Hi, my name is Robinson Leiva. I am a student of paramedicine. Today we will talk about fractures, types, and classification. Avulsion fracture. Separation of a small fragment of bone cortex at the site of attachment of ligament of tendon. People at risk. Thinner athletes, these lesions are more frequent in males. Barton fracture. Fracture of the distal and the radius into the right joints. People and reds by 15% bodybuilders. Bennett fracture. Fracture of the base of the fifth metacarpal band running into the carpal metacarpal in joints, complicated by subluxation. People at risk. Male sex was more prevalent for the activities carried out in the workplace and recreation. Blow of fracture. Fracture of the orbital floor causes by associated increase of intraorbital pressure due to traumatic force. The orbital concert earned into the maxillary sinus so that the inferior rectus or inferior oblique muscle might become incarcerated in the fracture site, producing diplopia on locking out. People and risks. Traffic accident. Closet fracture. On one that does not produce an open wound as opposite to open fracture. See illustration. Color also simple fracture. People and brakes in traffic accidents in sports. College fracture. Fracture of the lower and of the radius the distal fragment be display backfrag. People at risk. People over 65 olds show this fracture and result of a fall from growth level. Community fracture, one in which the bone is splintered or occluded, while the three or more fragments see illustration. People at risk. Older people with osteoporosis. Complete fracture, one involving the entire closed section of the bone. People at risk. Depositors. Composite fracture, open fracture. People at risk, traffic in accident. Compression fracture, one produced by compression. People at risk, traffic accident. Depression fracture, depression or skull fracture, fracture of the skull in which or fragment in depression. People and risk, traffic in accident. Direct fracture, one at the site of injury. People at risk have osteoporosis. Dislocation fracture, fracture of a bone near an articulation with concomitant dislocation of the joint. People at risk. Adults, children, uh, people during physical activity. Double fracture, fracture of a bone in two places. people and Rex children. Dupuytren fracture, Putz fracture, people at Rex, young male adults. Duvernay fracture, fracture, fracture of the ilium just below the anterior inferior in Spain. People at Rex, people who have high impact accident, older adults. Feature fracture, a crack extending from surface into but not stroked a long bone. People at risk, people which overload in sports, people which lower bone density diabetes and rheumatoid arthritis. Granitic fracture, one in which of side of a bone is broken and the other is bent, most commonly seen in children. See illustration. People are raised to children. Impacted fracture, fracture in which one fragment is firmly driven into the other. People at risk are older, have osteoporosis, have endocrine, are, are taking corticosteroids, are physically active, drink alcohol, smoke. Incomplete fracture, one that does not involve the complete cross selection of the bone. People and Rex, the children. Indirect fracture, one distant from the site of injury. People and rest, people over 65 years old. Interperiosteal fracture, breathing fracture. People at risk in athletes and military. Intertidine fracture, fracture a fetal bone included in utero. People at risk when the baby in the uterus. Jefferson fracture, fracture of the atlas, feet and cervical vertebra. People and Rex, 32, 50 years. Layer pit fracture, one in which the bone cortex is slightly compression and bulge on the side, on the one side, with and slight crack on the other side of the bone. People and Rex, pediatric age. Leaford fracture. Leaford one fracture, a horizontal segment fracture of the alveolari process of the portis of maxillar. A bilateral fracture of the maxillar in which the body is separated from the facial skeleton and the separated portion as a pyramidal shape for tree. A fracture in which the entire maxillar and the one or more facial bones are complete separated from the craniofacial skeleton. People and Rex, the 24 or 45 years. Longital fracture, one extending along the lattice of the bone. People at risk are frequent in middle age. Montage fracture, one in the proximal of the shaft of the wall of the ulna, which the location of the heels of the radius. People are wrecks before to 10 years of age. Oblique, oblique fracture. One in which the break extends in an oblique direction. People and wrecks in the kids. Open fracture. One in which worn throat addition of overlying soft tissue communication with the communication of the shades of the body. People and breaks between 20 and 40, between 20 to 40 years. Pathology fracture. To the weakening of the bone structure to the pathological processus angioplastia of osteomalacia. People are raised advanced age. Pertochanteric fracture. Fracture of the femur passing through the greater trochanter. People are raised advanced age. Both fracture. Fracture of lower part of the fibula with serious injury on the lower tibial articulation. People and breaks. Car accidents falls. Simple fracture. Closer fracture. People are wrecks, accident, a heart fall or a sport injury. Small fracture, reversible fracture. People and wrecks fall on the back. Spiral fracture, one in which the bone has been twisted and the fracture in the resembles a spiral. People and wrecks, twisting injuries. Spontaneous fracture. People's are right pathology. Sprain fracture. The separation of the tendon from insertion targeting within a piece of bone. People are wrecks, straightening of tearing of the ligaments. Stellar fracture. One which a central proof of injury from which wide radius numerous fissures. People are breaks, impacts, or falls. Cystic fracture, a fracture of the internal condyle of the femur. People are breaks, trauma. Transversical fracture, one through the neck of the femur. People are breaks, slide fall. Transverse fracture, one arise to the axis of the bone. People are right, direct height to the bone. Tropic fracture, one due to a nutrition tropic distress. People are breaks heights. Thank you.